Good morning, everyone. Happy Monday. It is, okay, let's just shout from the rooftops that it is not 95 degrees. Okay? There's no sun, which is awesome, and it's like 68 degrees, and it's lovely. So put your kids in those costumes right this minute because it's probably going to be like 100 degrees on Halloween anyway. So get all those cute little cozy costumes ready and get your kids in them and come on over here for Mom's Group and let's take a picture of those little cutie patooties. So happy Monday. I hope everybody had a great weekend. I'm going to address a little bit about what we talked about last week, which was mammograms and breast exams, and we did a little bit of a poll on Instagram. And overwhelmingly, we asked, are you afraid of a mammogram? Yes or no? Answer the poll. And overwhelming response was yes, fearful of a mammogram. So just to touch base on that a little bit, we're trying to come up with a way to help kind of resolve that fear. We want you to get your screening. So one is we may be doing a field trip in the near future over to the lovely Sheila Vilos Breast Imaging Center to give you guys a tour of what it looks like if you were choosing to do a mammogram. Do a little field trip over there, check out the waiting room, talk to some of the providers over there to kind of dispel some of the fears. And secondly, perhaps we will schedule some time here at the birth center. We have an ultrasound person that can come in. And maybe we just have everyone come in and do ultrasounds if that's appropriate. So I just wanted to touch base on that a little bit. We want to solve this problem because we do believe that screening is really important. And we know that early screening decreases our risk of metastasized cancers. So we're all about that. So if you are wanting to talk about it, you have some concerns about it, always please feel free to call us here at the Birth Center, at the Santa Clarita Birth Center, SCV Birth Center. The phone number is 661-254-3000. And we are in support of screening, whether it's a mammogram, an ultrasound, or thermography. We want to talk about that and get the screenings done that are appropriate for you. Okay, so that aside, today's topic, I wanted to talk about these fears we have in pregnancy. Basically, what can we let go of? What are some of these things that we think about as pregnant women, pregnant people here in our country? And yes, there are some things that we need to be concerned about, but there's a lot of things that we can just kind of let go of that really don't serve you as a pregnant person. And Dr. Google sometimes really feeds into those fears. So I just wanted to touch on a couple of things that you can let go of in your pregnancy that you don't really have to be concerned about. This topic comes up because we had someone that we met who had a tragic event happen to her in her pregnancy, and her care providers, her previous care providers, now she's in care with us, but her previous care providers told her it wasn't safe for her to grieve in her pregnancy. And it was just really hard. It's like, I shouldn't be sad. Oh my gosh, I'm grieving. There's been a death in the family. There's been some tragic event. And you have all these feelings, yet you're pregnant. And you're afraid that those feelings are going to affect your baby somehow. Listen, we talk about this here in our practice about grief is appropriate in certain circumstances. Stress, we live, there are some stressful things in our world. But remember, we live in a very privileged environment. The stress that perhaps isn't best for your baby is chronic, like war-torn countries. That is some serious stress, my friends. If you have a structure that you live in that's safe, you're not a victim of constant domestic violence, you have access to clean water, you have access to food. Maybe you don't have access to organic food all the time or even ever, but do you have food stamps? Are you able to go to a grocery store and purchase food in general, then you're ahead of the game in terms of a lot of our countries. So to put that in perspective, that your stress that we live in here in the United States, I'm not trying to minimize your stress, but it's the stress that most of us live under. If we have a shelter and we're not being physically abused and we have access to food and clean water, those stresses that you're living under are not going to have a detrimental effect on your baby. You're not going to cause, you're not going to damage your baby. If you are living in a war-torn country, that's really significant. If you are a victim of domestic violence and there's some physical violence going on, yeah, that's a dangerous situation and can really cause harm to you and your baby. And of course, we want to get you out of that circumstance. Food, it's okay if not everything you eat is organic. I mean, ideally, sure, if you can afford to buy organic, great. What you put into your body is important, but as long as you can get some proteins into your body and some vegetables into your body, you're going to do okay. So stress, remember to put it in its place. Grief is normal, and it is okay to grieve. You're not going to hurt your baby by grieving. Eating for two. Oh my gosh, am I eating enough food? I need to eat more food. You don't need to be eating for two, okay? You just need to eat. And what we recommend is that you eat every 2 to 3 hours and you eat some sort of protein. Maybe a handful of nuts. Maybe an apple with peanut butter on it, maybe a piece of string cheese, maybe a hard-boiled egg, right? So we're not talking about massive volumes of food. We're talking about quality of food, making sure that for our average pregnant person, that they're getting about 80 to 90 grams of protein a day. And sometimes we fall short of that, you know. Truth is, sometimes I eat popcorn for dinner, and it's glorious and fantastic, and I'll eat popcorn and I won't get my protein for the day. Now I'm not pregnant, but it's all going to kind of come out in the wash. And really, what you do in the first few months before you are pregnant is really important. It's laying that foundation for some good health. So many of our family members, many of our pregnant people, in the first 8 to 14 months, not months, weeks, 14 months of pregnancy, ladies and gentlemen, breaking the record over here. 8 to 4, those first few weeks of pregnancy, what you've been doing, being up to, the quality of food is really important, not the volume of food necessarily. The frequency and the quality is what's important. So let go of this idea that you have to eat for two. Let go of this fear that you can't grieve or be sad or be stressed out. It's okay to have some of those feelings. Acknowledge those feelings. Talk about those feelings. Maybe, you know, share those feelings with family members or friends. Support is really important during those times. We don't want you to isolate. We want you to share. So working through those issues is really important. Exercise in pregnancy. Should you exercise? Should you not? What is safe? What isn't? What can I do in the first trimester? First of all, it takes a whole lot to damage a baby. Our bodies are designed to hold a baby. Our uteruses are in the center of our body. They're in the core of our body. Our uterus is in a very, very safe place. So it's not that easy to cause yourself to have a miscarriage. So somebody came in and said, you know, can I get a massage? Oh my gosh, they wouldn't touch me at the massage place because I was 11 weeks pregnant. Listen, if all we had to do was like press on a button on our shoulders, that would like cause our cervixes to open and our babies to fall out. I mean, that would kind of be kind of fantastic. I mean, I'm like 40 weeks, today's my due date. I'm just going to press the buttons on my shoulder and I'm going to press these points in my hand and my baby's going to come out. My labor is going to start. I'm going to press these points and oh my gosh, it's going to cause me to miscarry. It's not that simple. The body is very smart and, you know, you shouldn't be doing extreme things, but massage is okay. The issue with massage in the first trimester is more of a liability issue. It's more of, I went and I had a massage at this really awesome place. at 8 weeks pregnant, and then at 8 weeks and 4 days you had a miscarriage. Oh my gosh, what did I do? Was it my massage? Our human nature is to blame ourselves or someone else for something that happened to our body. Most likely that miscarriage was just a spontaneous miscarriage. It was unrelated to the massage. It just so happened that miscarriage in the first trimester is not uncommon. So nobody wants to be blamed if you have that miscarriage, but I can tell you it's unlikely that your shoulders were massaged too much, which caused the miscarriage. But again, nobody wants to be blamed for that. And we don't want you to be in a place of like, could I have prevented this miscarriage? What did I do? So the rule of thumb is don't get a miscarriage in your first trimester, don't ride roller coasters, don't get a massage. Is that what I said?
You said miscarriage.
Oh, don't get a massage in your first trimester. Don't ride roller coasters. Don't lift anything too heavy, because we don't want you to blame yourself for any of those things. Not that those things really are going to cause a miscarriage. We just don't want you to blame yourself for it. Does that make sense? So, massage is lovely. Hot baths. People say, don't get in a hot bath. Oh my gosh, don't get in a hot bath. Remember, your body temperature is 98.6. Some people run 97 point something. Some people run a little bit higher, 99. Anything below 100.4 is kind of normal. It's not a fever. So a hot bath is about 99 degrees, maybe 99 and a half, maybe 100 degrees is a hot bath. That is safe for you to do. We don't want you to get into a jacuzzi. We don't want you to get into anything above 100.4, 101, 102. Jacuzzis are like 102, 103, 104 degrees. But a bath is really, if you just get in that nice warm bath, you run it, regular hot water from your tap, and you get in and you go, ooh, that feels really nice. That's not too hot. Remember, if you got into a tub that was 98 degrees, it's tepid. It does not feel good. It's cool to your body. So hot baths, right? Don't be afraid of a hot bath. A hot bath with a bunch of cups of Epsom salt, really, really awesome for your body. And if you just swirl your hand in there and you go, ooh, that's nice and warm, I'm telling you, that's about 99 to 100 degrees. If you go in and you go, ooh, hot, 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 I can't sit my butt down in that water, that's a little too hot for you. Run a little bit of cold water, right? Cool it off to where you can just get in and go, ooh, that feels really good. It should feel warm to you. It shouldn't feel hot. So hot baths, not really anything to be afraid about. Jacuzzis, not so good, right? It really overheats your body. So you could dangle your feet in that jacuzzi, maybe dip in and get out, but we don't want your core body temperature to be above 100.4. Eating for two, massage, hot baths, sleeping on your back. That comes up all the time. Oh my gosh, every night I wake up because I'm on my back. Why do you think you woke up? Because you were on your back. So it woke you up. Roll over to your side, it's fine. And it's really not even an issue until far into your pregnancy, maybe 6 months or so. And the issue is that as the uterus gets bigger, right? That heaviness of the uterus, when you lay down, the uterus can compress what's called your inferior lower vena cava, that major blood supply that goes up to your heart. So as you lay flat on your back, supine, or straight flat on your back without any kind of elevation, that uterus can press on this inferior vena cava and cause a difficulty in getting blood to your heart. So if you find after the 6-month mark you keep waking up and you keep waking up on your back, it's probably because your body is saying, hey, wake up, roll to your side, and just gently roll over to your side. Ideally, we think laying on your left side is better because that inferior boy, there's my New York accent, your inferior vena cava is runs down sort of the right posterior side of your body. So we say lay on your left side to make sure there's no compression on that side. But if rolling on your right feels okay or sleeping on your back feels okay, it's okay to do once in a while. And remember, we're talking about 6 months or further. Up to that point, that uterus isn't really heavy enough to compress the vena cava. So remember, normally when you're not pregnant, your uterus is really small. So not until 20 weeks, so that's 4, 8, 16, 19, 20 weeks is 4 months. 24 weeks is 5 months. Your uterus is just now coming above your belly button, right? So at that below, 20 weeks or less, your uterus is still quite small and it can't really compress the vena cava. So sleep in whatever position feels comfortable for you. Listen to your body. If sleeping on your back is the only way you can get some sleep, maybe just put something slightly under your your right side to kind of just lift that right side a little bit, and you'll feel a little bit better. So occasionally sleeping on your back is okay. So don't worry about it until after that 6-month mark. So there's that. Sex. Right? People are nervous about intimacy when they're pregnant. They're afraid that orgasm might cause them to go into preterm labor, or the partners sometimes have an issue with intimacy. Tricky. It's safe. It's safe. Intimacy is safe in pregnancy. Now, okay, I'm going to preface this all. I should have said this at the beginning. This is assuming we have a healthy mother. We do not have a history of chronic miscarriages. We have a normal, healthy pregnancy. We do not have a placenta that is covering your cervix. You've not been put on pelvic rest by a provider. You have no extenuating circumstances. We're talking about low-risk women. If you have a placenta previa, you're probably not, you're going to be on what's called pelvic rest. That means you're not exercising. You're not having any intimacy, because we don't want anything to disrupt the cervix and maybe cause preterm labor, cause some bleeding. Chronic miscarriages, you're going to be really careful in that first trimester. You're probably going to be really careful for the entire pregnancy. So again, we're just talking about low-risk women here. One previous miscarriage is not chronic miscarriage, and I know that miscarriage can cause a lot of anxiety through the pregnancy, and there's a lot of fear to share that you're pregnant. There's a lot of grief going on in a pregnancy, and it's okay to have those feelings. You're not going to cause yourself to miscarry by having those feelings. So those are some big things. I had a list here of what I was going to talk about, and I've forgotten some of them. So we were talking about stress. We talked about that. Eating, right? We're not eating for two, but you're going to try to eat as high quality food as you can get. Sleeping on your back. Oh, this comes up. People are saying, like, I'm not going to eat any peanuts in my pregnancy because I don't want my baby to have a peanut allergy. I'm not going to eat dairy because I don't want to increase a dairy allergy, or wheat because of a wheat allergy, or things like that. There are no studies that support the fact that what you eat in your pregnancy will cause an allergy for your baby. Now, if you have a family history of those allergies, of course, you might want to stay away from them because you have a family history of them for your own self. But babies are not becoming allergic in utero. We want you to eat a variety of foods. We want you to have a healthy diet. Is it safe to be a vegetarian or a vegan? Yes, it is safe. You do not need meat to grow a baby, right? We need healthy proteins, so legumes, nuts, seeds, beans, all really, really, really good for you. I was vegetarian through both of my pregnancies. In my second pregnancy, I think I ate eggs, was the only animal product I ate in my second pregnancy. And now I eat everything. So, we change through our life cycle of things that we put into our body. But you do not have to eat meat if you're pregnant. You can have a very healthy vegan diet in your pregnancy. We want you to get B12, which is difficult sometimes for our vegans to get. And vegan people out there, if I'm mistaken, please correct me. But B12 is something that we recommend our vegans supplement with. Spirulina is a great supplement for our vegan families. Spirulina, chlorophyll, alfalfa, those are some really great things. But spirulina is a really great way to get your B12. And for everybody, even if you are an animal product eater, you can really do well by getting some spirulina in your diet. But if you are vegan, just pay a little bit more attention to make sure you're getting those good proteins in, which most vegans are very much aware of what they're putting in their body. Plant-based people tend to be a little bit conscious about those things. So yes, it is safe in your pregnancy to continue your plant-based diet. Exercise. It is safe to continue to exercise in whatever way you were exercising before you got pregnant, right? Our rule of thumb is stay away from anything that makes you go, That's generally what I say. So my CrossFitters out there, if you're used to like throwing kettlebells around and that's working for you, right on, keep doing your thing. But if you're a mama that hasn't been throwing kettlebells around, I wouldn't just go over to your local CrossFit gym and start throwing kettlebells around, right? Anything that causes like a real like strain, we don't really want that going on for you. So walking every day for an hour is awesome. Hiking, and some of my family's like this, oh my gosh, can I walk uphill? Yes, walk uphill. Get on a treadmill, get on a bike. Watch your core body temperature. Watch your heart rate. You don't want to be at a high heart rate sustained. Interval training is really, really great. Keep doing what you're already doing. Our cyclists are one caution with outdoor cycling on your regular bike, road bike, mountain bike. Remember, as your uterus grows, your center of gravity gets thrown off. So it's more of an issue of falling off your bike. Equestrians, I have a little bit of an opinion about that. I don't know that it's evidence-based. I'm a little bit concerned about you getting on a horse and getting thrown off a horse or, things like that. So not my favorite activity. But what you already do, you can maintain what you're already doing. Exercise is really great for you. If you have not been exercising, you can certainly start an exercise routine, such as, again, walking. Walking every day for an hour is really great. You may not be able to, out of the gate, start at an hour, but certainly building up to an hour is really a goal. Walking is just great for your circulation. It's great for your frame of mind. Knowing what normal pregnancy symptoms are. So Dr. Google can be really, really, really intense. So try to stay off Dr. Google. Knowing that some low abdominal cramping is normal in pregnancy. Round ligament pain is normal in pregnancy. Nausea is normal in pregnancy. Constipation, headaches, all normal. Maybe, or all common, not necessarily normal, but not dangerous. So really understanding and getting a good idea of what's normal. If something's going wrong in your pregnancy, it tends not to be subtle, right? An early pregnancy, like a miscarriage, for instance, is a really kind of very big event. There's lots of menstrual cramping. It's early labor, it's lots of rhythmic menstrual cramping, and there's lots of red bleeding. It's not a little bit. It's not a little bit of pink. It's not a little bit of cramping. That's uterine stretching. So really understanding what is normal pregnancy and having a provider. And this goes for anywhere where you're having your baby. Hospital birth, home birth, birth center birth, with a midwife, with a licensed midwife, with a nurse midwife, with an obstetrician. Having a good relationship with a care provider that you can really get an idea of what normal pregnancy is. And then the next thing is let go of what's labor going to be like. I have my birth plan. I really want birth to go this certain way. This really does apply to those that are attempting an out-of-hospital birth because, there's quite a bit of an investment in it. There's a lot of people doubting you, whether you can do it or not. So we have this idea of I have to do it right. I need to have this out-of-hospital birth. I need to show everybody that I can do it. I don't want to transport. We cannot control the outcome of our births. What we can control is that we have a supportive team around us and who's going to support us in our birth. We have supportive care providers. We have an idea. It's like I tell people, it's sort of like acting. You rehearse and you rehearse and you rehearse and you rehearse, right? So you're going to do a play and you're doing all this rehearsal. You have weeks of rehearsal. And then it's opening night, right? And there's, oh my gosh, I really want this performance to go well. You've really worked super hard. And then, but you get on stage, and let me tell you, a good actor is going to get up on stage and live truthfully in the moment. And an actor that's working well is not thinking about, what did I do in rehearsal? What am I going to do next? They're not in their head thinking about how they're going to do the performance. They're living truthfully, saying, I did all that rehearsal, I'm letting it go, and I'm just going to live truthfully in this moment, one moment at a time. And labor is the same way. All you can do is live truthfully from one contraction to the next. If you're anticipating your next contraction, you're not in the moment of this one. And you just get in your head and you develop fear, and then you're in your frontal lobe, and now we have what's called fear, tension, pain syndrome. Also, it's similar, those that don't really get the acting analogy, it's like preparing for a big giant test, right? And you're studying and you really want to pull an A in this exam, and you know, you're working, and then you get to the test. It's like, look, you either know it or you don't. And you got to let go and just trust that you know the material, right? And it will unfold how it's going to unfold. But the anticipation and the fear that building up to the day of your labor, you got to let it go. Trust that you have the right team. Trust that you've done the homework. Trust your body, because we know that our bodies know what to do. And if it winds up that you wind up with a C-section or an induction or some intervention, if you've done your homework and you're well informed, you're going to have the birth you have. And you know what? Some of us need C-sections. And that's okay if there's informed decision making going on. Some of us need to be induced. Some babies need to come out before our bodies are ready to let them come out. I mean, there are instances where we just have to let go and trust that our bodies are going to work and we're going to get the outcome that we get. So anticipating all that in your pregnancy and holding on to this idea doesn't always serve you as a pregnant person, right? Doesn't always serve you best in your pregnancy. There's a quote that I read today: you cannot force a perfect birth story, and worrying is not going to get you one, right? So worrying about that birth isn't going to get you any closer to a perfect birth. So let go of worrying what labor is going to be like. Know what your normal pregnancy symptoms are. That's very helpful. Sleeping on your back, eating for two. There you go. So I think we hit on some big topics here. And this applies to anybody, no matter where you're having your baby. Trust that, you know, it's going to work out. I mean, that sounds pretty trite, but the truth is that our bodies know how to grow babies. For the most part, we will grow a perfectly perfect baby. The majority of us will have perfect babies, and that's just how it works. Yes, there are some times where things don't work well, but it's often not anything that you've done, unless you're, you know, doing some serious damage to your body. You're really putting some dangerous chemicals into your body. You're, you know, there you go. I'm going to end it there. So take that home, share this with your friends. If you find these Midwife Mondays to be helpful, they're uploaded on iTunes. I believe they're on our YouTube channel. Share with your friends. Post a comment. If you do that, that's really helpful for us. If you like it, and share it, and just put a comment saying, hey, awesome content today. That we appreciate that. Follow us on Instagram. And there you go. I hope everybody has a great day. And please feel free to ask us questions, email us, comment, and we're happy to answer any questions you have. Okay? Have a great day, you guys. Bye.